Okay. It's my honor to share this platform with you today, to share knowledge and self-practices that hopefully will translate into better care of our patients, not just during Ramadan, but throughout in our interaction with our patients. Thanks again for having me. I'll start sharing my slides. Are my slides visible? Hello?
Yes.
Yes.
Hello?
Yes, they are.
Great,
Yes.
great. Thank you very much. Thank you very much. From the outset, I would like to say, given the diversity of my audience, I'll try to stay as basic as I can. Okay. A minute, please.
Doctor, you are breaking.
Yeah, okay. I have an issue with my laptop. I need to connect the charger. A minute, please. Battery. A minute, please. I locate my my charger.
As Dr. is connecting, we expect this discussion to be as interactive as possible. So you can unmute and ask question in between the presentation. But for the questions on the chat box, discussed at the end of the presentation.
Thank you, Madam Chair. I'm back.
Welcome.
Thanks again. Yes, the challenge to remain as basic as possible, yet clinically relevant. So I'll try to do that, but however, do not feel limited in your interactions and questions. Please, you can get as extensive and intensive as you should please. Thanks. Okay. Ramadan is one of the holy months in the Islamic calendar. Stretches between 29 and 30 days. It's a period where Muslims, mentally fit and physically fit, partake in this journey, spiritual journey, that entails abstinence from food, drink, smoking, and halal intimate relations from dusk till dawn. Depending on the geographical location on the globe, this might range between 8 hours to over 14, 16 hours. I'm aware there does exist other forms of fasting. You have your intermittent fasting, the 18/6, and different proportions of hours where individuals abstain from eating for the larger portion of the day and limit feeds to just 6 to 8 hours of the day. However, there's liberal drinking of fluids, mostly water, throughout the day. So that form of fasting does exist. There also does exist another form of fasting where individuals abstain from greasy or fatty meals, where individuals abstain from proteins, meat. So one fundamental difference between those sorts of fasting and the one observed by Muslims is the complete abstinence of both foods and liquids. from dusk till dawn. So that's the fundamental difference between those two fasting. Okay, so complete abstinence from food and drink for in East Africa, we'll say for a period of 12 hours. So that sort of fasting brings along challenges, health challenges, in particular among patients living with diabetes. Okay. So among the established risk factors that patients living with diabetes encounter during fasting are hypoglycemia. These are unacceptably low sugar levels in the blood. Hyperglycemia, which is excessive levels, high levels of sugar in the blood. Dehydration, contraction of the fluid compartments in the body, and what comes with the dehydration in form of thrombosis, that is clotting of blood within blood vessels. Okay, so these are established dangers that individuals living with diabetes encounter during a period of fast. And of course, as the length of fasting extends, so do these risks become bigger. Okay. Sorry. So in the backdrop of the dangers I've just, or the risks I've just touched upon, and the clear exemption by religion of individuals that cannot partake in the fasting, owing to physical disability, physical disease, mental disease, pregnancy, etc. Despite the dangers, despite the exemption, a significant proportion of Muslim men and women suffering with diabetes opt to observe Ramadan fasting. How significant a proportion is this? Going by published data, among type 1 diabetics, approximately 40% of Muslims living with type 1 diabetes opt to fast during the month of Ramadan. What's the situation with type 2 diabetes? About 79% of type 2 diabetics opt to fast Ramadan. In general, at least 80% of Muslim men and women living with diabetes fast at least 15 days of the month of Ramadan. Putting this into perspective, with the 2045 IDF projection of people living with diabetes, which will be 700 million people globally, the projection, that translates into 1 in every 8 individuals living with diabetes by the year 2045. A loose approximation is approximately over 50 million Muslims opting to fast the month of Ramadan. This number clearly displays the public health concern and need to address the safety of these individuals should they opt to fast during the month of Ramadan. So how do these risks come about? How does hyperglycemia come about? How does hypoglycemia come about? Okay. A few hours into fasting, we observe low levels of glucose in the blood. Body mechanism sensing the same, they shut down or reduce insulin secretion so as to conserve the little glucose in the blood that is available. At the same time, counter-regulatory mechanisms kick in to try to maintain the low levels of sugar or even boost the sugar levels during that time. Glucagon kicks in, catecholamines kick in, acting on the liver to promote gluconeogenesis, which is de novo synthesis and manufacture of glucose, which in turn elevates your sugar levels. Glucagon also burns fat in the liver, fatty acid oxidation, giving rise to ketosis. These are ketone bodies that are responsible for the acidosis which we observe in DKA. Okay, so these are body adaptive mechanisms to low blood glucose. Of course, in Ramadan, there's prolonged periods of not ingesting food, so glucose levels fall, and this leads to hypoglycemia. As the gluconeogenesis and ketogenesis takes deeper effect, glycogen stores drop and glycogen breakdown increases. Both two conditions contributing to both hypoglycemia and hyperglycemia. Now, this is physiology of fasting in an average individual. Some of you must have observed that if you take a random sugar of an individual during a fast, late into the fast, let's say 4, 5 p.m. in the evening, you will always find some level of sugar, some 3, 4, even 5 sugar in the blood. Despite this guy being in like 8 hours or 10 hours of fasting. In the same individual, if you take a urine sample, you will find some ketones in the urine. So this is how the body deals with hypoglycemia in the short term. Okay, now this is in a normal individual. These mechanisms are heightened. These mechanisms are exaggerated in people living with diabetes. So the problem becomes more profound. Okay. Now, with the hypoglycemia in mind, with the hyperglycemia in mind, with the risk of dehydration in mind, with the risk of thrombosis in mind, and the clear exemption of individuals who cannot partake in fasting in place, how do we go about stratifying our clients and our patients into categories that we might allow to fast, we might advise against fast, we might strongly dissuade from fasting? How do we go about stratifying risks in our patients? This is an old stratification before the current one in 2021. I would like us to take a few minutes to appreciate the increasing risk factors, moving from bottom to top, from the green to the red. I want us to appreciate the increasing risk factors as we move through these colors. The green, you'll realize these are low-risk individuals who are controlling their diabetes on just diet, who are controlling diabetes on 1 oral medication or 2 or 3 with very little risk factors for hypoglycemia. As you move through the orange, moderate glycemic control, or who are on medication that have less impact on hypoglycemia. Moving towards the red, these are individuals at greater risk of harm, injury to their health, should they decide to partake in fasting. What sort of individual are these? Individuals with hypoglycemic unawareness. These are individuals who, despite their sugars being too low, their bodies refuse or they fail to recognize symptoms of hypoglycemia and stay in that state for a protracted period of time. Individuals who've had episodes of hypoglycemia in the past 3 months prior to Ramadan, individuals who had HHS or DKA 3 months prior to Ramadan, pregnant women, people engaging in hard physical labor, not the type 1 diabetes in the old classification. Okay, so this is the old stratification of risk for individuals opting to fast the month of Ramadan. What's new in the new stratification calculator? So in 2021, the IDF-DA collaborated to come up with a risk calculator. A calculator per se, where you can enter, you can enter data and it generates